You won't want to miss this test if you have pubic symphysis pain, SI joint pain, hip impingement, adductor strains or tightness, deep hip rotator tightness or knee pain. Okay, that's a lot of things. So just make sure you join me for a quick and easy test to assess what's going on in your adductors. I want you to stand with your feet hip-width apart in a squat, making sure that you're lengthening in your glutes and having equal weight in your feet as you go into that squat. Now, holding the position, let's explore what happens and what you feel when you go to pull your feet and knees in towards each other. As you go to this, do you notice that your knee likes to turn in or collapse in? Do you tend to roll towards the inside of your foot? Or do your feet stay grounded with knees pointed straight ahead as you go to pull those feet and knees in towards each other? When you touch the inside of your inner thighs, do you feel equal muscle bulk on one side, or is one side bigger than the other? As you go to this, are you getting any kind of knee pain, SPD pain, or SI joint pain? Let's talk a little bit more about what all this might mean. For those who have a lot of tightness in their posterior hips and have knees that like to turn out, then we might need to think about, as we go to squeeze in, as if we're trying to drive more of the movement from the base of the big toe and drive more into rotation. The trick is still doing that while making sure that those knees don't collapse in, but maybe we need to think about them pulling in some if your tendency is to kind of have those knees bow out more. If your knee already likes to be turned in, this can indicate that you're overusing your adductor longus or your hamstring portion of your adductor magnus. This can affect pelvic floor tightness, femur positioning, and can contribute to hip impingement and knee pain. So for those individuals, we might want to explore driving more of the pulling in from the inner heels and feeling how that engages your adductor a little bit higher and can help drive more movement from the pelvis rather than from the femur. Now, we want to make sure as we go to do that and squeeze in more from the heel that we don't lose this nice glute length and end up kind of shoving forwards. So we're making sure we're sitting back into those hips and then maybe squeezing in from those heels a little bit more while we're still keeping that space open. If that doesn't quite feel right, it might mean that you need to kind of explore some moves otherwise on your own a little bit to reevaluate how we're accessing those adductors to help work on pelvis movement. It could also be that we need to address what's going on in your adductors compared to your glute med to look for imbalances that can contribute to femur positioning and pelvis positioning in this frontal plane that will set up how you're functioning in your hips. Now, as you go into this position as well, if you are feeling any kind of SPD or SI joint pain, then that can also indicate imbalances between the adductors and the glute med, as well as maybe having a shearing action occurring in the pelvis because one side of your pelvis is in more of an anterior pelvic tilt compared to the other. So to touch first on kind of this imbalance between adductors and glute med, it could be that if I have one knee that likes to kind of pull in a little bit more, that can be in and of itself happening. It could also be that maybe the other side has a little bit more adductor weakness, okay? So we have a dominant adductor on this side and a weaker adductor on this side. So what I might need to do instead of just being in this squat here is I might need to think about my feet being a little bit wider and thinking a little bit more how I need to get length in this adductor to improve this femur position and push this right leg away, abducting it. This is gonna get my glute med here, okay? Knee isn't turning out. And then I might pull in with this left inner thigh. So now we're creating this opposite action of what likes to happen to create balance in my pelvis. That all being said, that can be tricky to do all at once. So as I mentioned, you might need to work on those individual components first, maybe some adductor release work on this right side, maybe some more glute opening work on this left side first, before then tying it all in together. The other thing we can pay attention to as well is how well are you sitting into both hips? So as I'm sitting here into both hips, can I think about sitting straight back and down instead of off to the side? If I tend to sit off to the side, we can see how now this is affecting the position of my femur and the position of my pelvis that's going to affect attaching muscles. So we're maybe going to have to think about sitting back into that left hip a little bit more to help me not shift away from it. We're paying attention to a hip not hiking up, so you might have to think about sitting straight down to create that equal engagement, and then go to squeeze with your inner thighs from there and see if that makes a difference. If it comes to a pelvis, one side of the pelvis that's in more of an anterior pelvic tilt relative to the other, that's another way of kind of getting around sitting into your hips. So we can see how if, say, my left side tends to be flipped more forwards, then I can think about kind of as I go into that squat, what happens if I drag my left heel back to find that hamstring to drop down into that left hip and then go to squeeze there. So as I go to kind of drag this left heel back, we can see how this creates a little bit of a hip shift of my right knee forward relative to the left, and then I can go to squeeze. Once again, that might be something that we need to explore separately before trying to apply it into the squat. The great thing about SPD and SI joint pain is you can use that symptom and discomfort gently to kind of tell you about what your body needs. If I go to do that drag back and I go to squeeze and it feels better, good. That is what my body needs more of. How can I think about other ways to accomplish that? If I go do that and it feels worse, I might need to evaluate how I am doing that drag back and maybe do it in isolation. Or I can also say, oh, maybe that's the direction my body doesn't want to go and kind of the area that I'm already stuck in, the direction I'm already stuck in. So what if I drag back the other leg and then go to squeeze? Do my symptoms feel better there? So a little food for thought there of how, again, you can use that symptom in your exercises to help figure out how we need to counter rotate to bring better balance to the system. I hope that gave a little bit of wheels turning to think about, what adductors are engaging, how am I engaging them, and how that might be contributing to the bigger picture in my system. If you'd like to dive into more of those ideas, make sure to check out some of our other helpful videos that we have listed here as well as in the description below. Speaking of the description below, if you're a movement professional who wants even more, make sure to check that out so that you can see what professional continuing education courses we have to offer. And as always, don't forget to like, subscribe, or leave a comment with feedback or questions, and we will be happy to respond. Thanks again.